You're listening to the Yoga Medicine Podcast. I'm your host, Tiffany Cruikshank. Our podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts, Rachel Land and Katja Barch, as we dive into all things yoga, research, and wellness. The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs. All right, we are back, and I'm excited because we're going to really focus in on the applications of MFR. And keep in mind, in these research reviews, we're really looking at what the research is telling us. Katja is great at collecting all of that information. And so what we're looking at is what we know at this point, which will continue to grow over time as we get more research. But to keep in mind that there's a lot of individual variables here, variances from person to person. And so your experience is also very important. So keep exploring, keep finding what works for you. This is not to the end of the conversation, but this is just what the research has told us to this point. And also keep in mind the context. What are you trying to do with the MFR? What are you using these practices for? And another thing to keep in mind here is that MFR stands for myofascial release, which really, as we're talking about it, we're really talking about what's often called SMFR, which is self-myofascial release, which basically just means you're doing it to yourself. So that could be with balls or foam rollers or other tools that you like. In contrast to, if you might receive it from a body worker, from another practitioner applying it to you. So we're going to talk about what the research suggests at this time in the application of things like the duration of application of MFR, the frequency of application of MFR, the speed and intensity that you apply it at, different tools, and then of course some other applications when we're combining MFR with movement and stretching and yoga practices as well. So we're excited to give you lots of things to go and experiment with. Let's start off with duration and frequency. Katja, you want to kick it off and start there?
Yes, and I want to start by really saying that what you just mentioned, context, is really important with all the research that we're looking at, but also when it comes to duration. So the research kind of distinguishes a little bit between the intentions that you can come to MFR for. Let's say, for instance, recovery or pain alleviation, or do you do MFR for performance enhancement or before sports, or do you practice MFR, for instance, to gain flexibility? And depending on what you want to achieve, the recommended durations vary a little bit. And I'd say let's just start maybe with the alleviation of pain and recovery, which is something really attractive for people. And when we look at the research, and when I say we look at the research, we try to pick out for you articles that sum up various articles, so that have some, quite good degree of evidence. When we look at recovery, we would see that we need a minimum dose of about 90 seconds for that to kind of kick in, or for that effect to really hold place. And 90 seconds is the minimum. There are some studies where they did MFR for 10 minutes and that still was good. So there's really not that much of an upper limit when it comes to the work of MFR in terms of recovery and pain alleviation. But 90 seconds is really kind of that minimum time frame we're looking at.
I love that. And I think for me, 90 seconds implies that we want to stay there long enough to have a meaningful effect, a meaningful conversation with the tissues. I think as yoga teachers or fitness professionals or healthcare professionals, anyone who teaches this work, you see a lot of people, especially athletes, who come in and they're just kind of trying to like scribble and scrub all over and they kind of end up making their way everywhere, but not really spending and it's not just athletes, but really anyone who hasn't really looked through the research or done a little bit of research on this tends to kind of we want to do it all. And I think it comes from a good place. We love the practices and we're just trying to kind of get all the spots. And yet, when we look at this research, we know that spending a little bit of time, and this is my experience too, spending enough time to have a meaningful conversation with the tissues will be much more effective, even if you can only get to, in my experience, this is just experience and opinion, even if you can only do 1 or 2 spots, like finding the couple that you feel will be most helpful and spending some time with them. And reality is 90 seconds isn't really that long. It's pretty quick as far as, especially because we're talking about recovery right now, where part of what we're talking about is resetting the nervous system, is downregulating the nervous system, having that parasympathetic effect. And, a lot of our other practices in yoga, like restorative, we might take half an hour or an hour or an hour and a half. And so 90 seconds, I think in contrast with that is very quick. So, it's not just kind of going all over the body. I am taking some time there, and that's the minimum dose, remember, for those of you who are listening. And then it's also transient, right?
Yeah, exactly. So we can see that those effects, particularly when it comes to the sensation of pain or the improvement of pain sensation, that they go away after some time, those improvements. So 5 minutes about, we can say, when it comes to the reduction of pain sensitivity after 5 minutes, the research says that kind of comes back. So that alleviating effect is transient, as you had just mentioned.
And I think that 5-minute one, I think we have a lot more to learn on that. And pain is so multifaceted. This is one study, right, that we're talking about for the 5 minutes.
I think that was one study. Exactly. Yeah.
And I think what that tells us, and you always have to elaborate what these findings mean to you in clinical practice. And for me, what that means is what we all experience is temporary. Maybe it's not 5 minutes. I think for a lot of people that I work with, it lasts a little bit longer. But I think what's important here is that we are doing other things as well. And I always tell this to my students and my patients, the MFR is so easy to get buy-in to get people to do and follow up with, but I think the biggest risk with it is that they end up becoming dependent on it, is they just keep doing it. And so this is where, for me, the yoga provides a lot of the long-term effects, or maybe the strength work that you're doing is providing some of the long-term effects, or the restorative or pranayama, the other things, we can do to help kind of change the situation in the long term. And then also keep in mind that there is a cumulative effect, even with MFR. We're really looking specifically at acute changes with pain in this study. But we know that these practices, anything that we're applying to the connective tissue regularly, that could be fitness training, that could be MFR, that could be yoga, is going to somewhat affect how the matrix of the connective tissue is being remodeled over months. So those are the things that we repeat. So, however, it's transient. So if you're an athlete and you're using this, we're talking about recovery, I know, but we're heading to athletic performance next. But if you're using this for athletic performance, you'd want to be doing that right before you go out, knowing that especially that was pain. If you're using it for pain, I know I'm kind of double dipping here. Let's talk about range of motion, because when we're talking about athletic performance, we're talking about range of motion, especially if there are impairments due to loss of range of motion that relate to your sport or your fitness endeavor. Range of motion work before an event, before training, before sport, before performance can be really helpful. So what are the findings there?
For range of motion improvement specifically, we're looking at a somewhat shorter time frame. So the research that has accumulated points to the fact that about 45 to 90 seconds is already enough to achieve those really acute effects of range of motion improvement. And that is not specifically before or after sports, but generally, if you just want to improve range of motion, a bit shorter duration, as I just said, is already sufficient. And I think it's still long enough for that meaningful conversation. 45 seconds to 90 seconds, as you already also elaborated. It's a little bit of time, but it's not too long. So it's really a short practice that gives us a great increase in range of motion acutely. And that's what many people are happy to receive and are looking for. So I think that's good news for our practice as well.
Awesome. So a little bit shorter for range of motion than what we're talking about for pain, which makes sense because I think a lot of what we're looking at with pain changes is also nervous system shifts. So having a more kind of slow, melting, meaningful conversation with pain and recovery, and maybe a gentler conversation for recovery. And then for range of motion, 45 to 90 seconds is really all you need. And again, we're talking a lot about minimum. So it could be more. And I think if you're an athlete, if you're someone using this for range of motion, pre-sport, pre-train, pre-yoga, short and sweet is good anyways, because sometimes you may have experienced this. If you spend a long time on an area, sometimes you can make an area sore. I mean, obviously, hopefully we're doing it gentle enough that we're not inducing soreness. That's the important point. But being able to get short and sweet pre-sport for range of motion effects is a really great one, 45 to 90 seconds.
Yeah. And when we look at those effects, they also are transient. So some studies do only find that effect for a couple minutes, like 2 minutes or so. But generally, summing up the research, we land at about 10 minutes for that effect to hold on. So after about 10 minutes, you could assume that those range of motion effects might decrease again. So especially in the context of sport, but also within our yoga practice, that might be an interesting information as well, that those range of motion increases, they last a little bit, but not forever, like not for an hour or so. At least that's what the research says at this point.
Yeah, and so this kind of goes with a lot of the things that we use in yoga too. If you're working with athletes or have done our trainings on athletes too, you want to use that MFR to induce range of motion changes and then get them into their more dynamic warm up, their sport specific warm up, and then into their training so that you can capture those range of motion changes in active movement so that you can carry them through to your sport. And so, just because they're only lasting 10 minutes, these are on people who are doing, I'm assuming, nothing afterwards. So those range of motions, I think range of motion changes we can capture as long as we are actively using them in our sport. Once we become more sedentary, I think a lot of that's going to diminish pretty quickly, I'm assuming.
Yeah. And also, as you're mentioning sports and the application of MFR before sports, we should mention probably also that if you do apply MFR before sports in order to even improve your range of motion, and not only range of motion, but to improve your performance also. And we might take a side note here because MFR has shown to improve performance a little bit in some cases. So we're not talking huge effects here, but when it comes to speed and strength, there are some cases where MFR has actually an increasing effect on those performance parameters. And if you're looking to do that, not just range of motion increase, but performance increase, you're doing it before your sport, you might want to hang out a little longer again. So the current research states that 90 to 120 seconds, so 1.5 to 2 minutes is the threshold to go for if that's your goal. So for athletes, putting that into context as well might be something worth knowing and worth mentioning here.
And some pointed to a little bit less too, right? The 60 to 90 seconds, or is that just less so?
Yeah, the 60 to 90 seconds is what some studies are referring to. But if you look at those systematic reviews, so that's research articles that sum up various studies together, and there's a couple of those systematic reviews now. If you accumulate the information that you have from various of those systematic reviews, we would land at those 90 to 120 seconds. But I think, what we've talked so far is we've heard 90 seconds in all of those increments, basically. So if I would have to recommend someone something, and they're out back in their practice, they're out on the field, and they're trying to remember hardly what Tiffany and Katja said during the podcast, and they cannot really distinguish between the different intentions anymore. which is understandable. I would say that if you take the 90 seconds for all of these purposes, you're good to go. So I would maybe say the 90 seconds, that's kind of what we get in many of those areas. There are slight differences, but the 90 seconds, I think, is something that we could keep in mind for the different intentions or goals that we're looking for with MFR.
I like that. And basically it's giving us an approximate, I think from our purposes, usually as a teacher, I'm not usually counting the seconds. You get kind of a feel of it, but usually for me, it's a minute or two is about what I'm looking for. There's a few areas of the body that are hard to stay much longer than a minute, like each spot on the IT band. And, and this is per spot or per the whole muscle group?
Per muscle group, that is. And also keep in mind, I'm really into research. If you don't know by now, you haven't listened to many of the episodes, but I really am. But I really also have to say that while the research on MFR is really increasing and we have more and more evidence, the different study protocols are still very diverse. So one study might have done 2 times a minute, and then those were the results. And one study might have only looked at a male population and maybe young athletes, and the other maybe has looked at both sexes. So there's still quite a diverse study design in different studies going on. So don't take that set in stone. I think if we go with the 1 to 2 minutes in one muscle group, I think that's really a reasonable recipe or a reasonable recommendation we can give based on the very still diverse research landscape out there.
Yeah. So we're looking at a few main categories. We talked about recovery, which would be done post-sport, post-training, or maybe on an off day, between days. We talked about it for performance and range of motion, which would be done pre-activity. Or, you could do these for range of motion if you're not using it specifically for training. You could just do it on its own, of course. If you're using it for range of motion, if you're not active, you could use it on any time. But those would usually be done pre-sport, pre-training. But then there's another group. So these are the common areas that we use MFR for: recovery, performance, range of motion. But then there's also this look at how it affects tissue stiffness and blood perfusion of the tissues. And what are we finding in that realm?
Yeah, and the study I'm referring to here is a rather new one from 2021, and I just want to point out that Jan Wilke was involved in that one as well. And if you have read some of the research, or if you're familiar with all the fascia stuff that we talk on here, chances are high that you have heard his name because he's really deep into that field. So always interesting to take note of that. That's really high level research there. And so they did compare different protocols of rolling on and looked at the effects on of tissue stiffness and of blood perfusion. So tissue stiffness kind of also would point to range of motion increases potentially, and blood perfusion, so how well the tissues are
circulation,
filled with blood or circulated. That's the two parameters they looked at, and they compared one time, they did 2 times 1 minute of rolling, and the other protocol was 2 times 3 minutes of rolling. And they separated that by 1 minute of rest, and they looked what had bigger effects. And what's interesting to notice that for that blood perfusion, the longer increments, so the 2 times 3 minutes, were even better. However, the changes in tissue stiffness, so a decrease in stiffness, already appeared after the 2 times 1 minute protocol, alongside the improvement of circulation. So both parameters they looked at, circulation and tissue stiffness, had already improved after the shorter increment of time. So that would be 2 minutes. And that again falls into that category of the 90 seconds roughly that we had talked about. And so that's also something that might be relevant before your sport. So if you're looking to decrease that stiffness and increase circulation, that shorter time frame of 2 times a minute or 90 seconds, as we mentioned, might already be enough. So that's for athletes, again, potentially very interesting.
So just to summarize, you're saying that the tissue stiffness and the circulation both kind of maxed out in that 2 rounds of 1 minute of rolling. And when they got to 2 rounds of 3 minutes of rolling, it didn't get any higher. It didn't improve. Or
The
did the
blood,
circulation?
the circulation did, but
Did
you
improve.
already had, it did improve even more in the longer increment, but it did already improve significantly in the shorter duration. So if you are an athlete and you're always looking for the most time efficient protocol you can find, be it before training or before competition, you're already good if you go with a shorter
Mm.
duration.
So the 2 rounds of 1 minute showed good changes, good enough changes, even though there was a little bit of an increase in the circulation of 2 rounds of 3 minutes. So not
Exactly.
necessarily needed, but it will get a little bit more circulation. And I love that they showed the cadence on this one. It's kind of interesting. They did 30 rolls per minute, which is basically 2 seconds per stroke, which
Mhm.
it's not really telling us. I don't know what part of the body they were on. Do you
I
remember
think
what
it was
part?
the anterior thigh. So it was from the knee all the way up to the hip.
So that's a pretty long stroke. Yeah.
Yeah.
I mean, I'm assuming they maybe weren't going the whole way, but 2 seconds is fairly quick, I
Yeah,
think.
fairly quick. We will see later, or we can talk about later about, or actually, we might just jump into that, into different speeds. So, again, Jan Wilke and his group, so kind of from the same research environment, they also did one study where they compared different rolling speeds, and they had a fast protocol and a slow protocol. And in the fast protocol, they were going even a bit quicker than what we just said, also anterior thigh in a prone position, and they did 1 stroke per second. So that was their fast protocol. So even a bit quicker than in this study. And the slow protocol was 10 seconds per stroke. So yeah, 6 strokes per minute. So a lot slower. What was interesting, though, they were looking again also at tissue stiffness, and tissue stiffness changed in both of those conditions. But that's interesting. It changed in both conditions, but it didn't matter so much whether they went really quick or if they went really slow.
Hmm.
So that's kind of interesting. It's one of the very few studies that we really have on speed. And for a while, at least, that's what I experienced over here in Europe. It was recommended to roll as slowly as you can to receive the biggest effects. But apparently that doesn't hold true, at least not when it comes to tissue stiffness, because both those speeds had the same effect, or both had a similar effect on tissue stiffness there.
Gotcha. Really interesting. I like that. But there's some other information on speed I think that's interesting, and as it relates to pain, as we compare
Yeah,
it to, I think you found that is a little different.
exactly. So if you're looking, and that's of course very relevant if you're working with myofascial release balls, for instance, and if you're looking to do that kind of acupressure type work, if you're looking particularly to work on myofascial trigger points with a ball, for instance, then they found, and again, Jan Wilke was involved in that one and the first author for that study, a really static hold was more beneficial than dynamic rolling. So if you're in fact looking to work on a trigger point, just hold still, be static in one
Mm.
point. That's better than the dynamic rolling. If you're doing it for other purposes and you're rolling, I think what their study found is giving the practitioner leeway, maybe, or room for their own sensation and their own feeling what they recognize as being best for their body.
It totally makes sense to me because one, when we're talking about pain, I mean, partly what we're looking at here is that effect on the nervous system with those Ruffini endings. And we know the Ruffini endings respond to that slow melting pressure. So that makes more sense that this more static um, input would affect them versus, when we're looking at the mechanical changes in the tissues, the speed maybe not being as important potentially. I
Yeah,
don't know. It makes sense
potentially.
to me, at least.
Yeah. And we also, I mean, we do have to say that when it comes to myofascial trigger points, the pathophysiology behind that is still not 100% clear. So we
Yeah.
don't really understand the mechanism on about what type of work really helps with that kind of pain. But apparently it did with that static work with rolling. So I think, yeah, we can go with that, even though we don't understand the full picture yet.
Do you remember how many people were in those studies? About the size? Do you remember offhand? That
I
might
would
be
have
asking
to
too
look
much.
that one up.
Because my guess is they're
I would
probably
have
still smallish, in the 20s or
probably still
50s, maybe.
smallish.
Yeah.
I do know that they always, before they do their studies, they calculate how many people should be in the study for the statistics to work out. So they typically do that. They don't just, advertise for a study and then if 10 people come, it's okay. But typically in those types of studies, most studies have, I would say, around 15 to 30 people potentially, maybe a little more, maybe a little less. It depends, but I would say that's probably the rough frame for that.
Yeah, that makes sense.
Yeah.
So again, there's a lot more to be learned, but I think this gives us a rough idea. And most of these studies we're talking about today these are both from 2018. Most of them are 2018 or newer. There's a couple from 2000, one from 2013, one from 2014, but most of these are pretty new studies. And as always, you can find these references in the show notes, so you can poke through and look at some of the details. All right, so we've talked about the duration and the frequency. Did we talk about frequency? Oh, we did talk about the frequency and the stiffness and perfusion. Is that where we were talking about frequency a little bit?
Yeah, there's maybe one really recent study from 2022 that's worth mentioning because it's one of the very few articles that looks at the chronic effects of rolling. So that's effects that are looking at a time frame of more than 4 weeks. So most studies look at the acute effects of myofascial release. So you do an intervention, you do some rolling, and then they measure stuff, and then they're done.
Yeah.
But there's now that one study from 2022 that is linked in the show notes, and that is a review. I think it had 9 studies in there, and those were all the studies they could find to date, 9 studies that looked at the chronic effects. And they also looked at the frequency there and recommended that 3 times per week seems to be a good increment of time, or a good frequency actually, when we want to improve range of motion again. So range of motion increases over a longer period of time, 3 times a week seems to be a good recommendation.
Interesting. I don't think I've seen that one yet. I'm going to have to poke into that one.
Really
I
new.
love
I think
that.
it's just a month or 2 old. Yeah.
I love that. That's great. All right, so let's talk about the intensity. I think that's kind of the next phase, like how much, how deep. And I actually, in the study we looked at from 2021 on tissue stiffness and perfusion, just as a back note, the one where they were comparing 1 minute of rolling twice versus 3 minutes of rolling twice, they were using a third of the body weight. So it was interesting. Sometimes they do note that and do, put that into the specifics of the study. And a lot of times they don't, because sometimes it's hard to measure. A third of your body weight can be kind of rough. But that one did have a little bit of an intensity marker. What else do we see for intensity?
Yeah, so in studies, sometimes also full body weight is used. And then the research oftentimes actually discusses that. So does that have an influence if I use my full body weight versus, for instance, a third of the body weight? So there's still different types of protocols out there in the research. What's often used as well is kind of like a pain rating scale. So people are asked to roll at an intensity of 7 out of 10. With 0 being no intensity at all or no discomfort, and 10 being maximum discomfort. So a 7 out of 10 is what is being used often in the research. So if you're looking at the results that we're discussing today, that's oftentimes the intensity that is given or that is used in the study protocol. So that's one thing to note. I think it's also something that you could go with in your practice or in your teaching, like cueing an intensity of a 6 to 7 on a 10-point scale, but maybe not more. I think that's also a good takeaway for teaching or for your own practice there. And then when we want to look at specific study results, there's also a rather new one, again from 2018. And they looked at different intensities, again, using that point of discomfort. And they did roll with 50, 70, and 90% of maximum discomfort. So that would be basically a 5, a 7, or a 9 on a 10-point scale. And again, looking at range of motion as an outcome parameter, they didn't find a difference. So for me, it's just one study. But again, it kind of gives the practitioner leeway to play and to really, being okay with trying out different protocols there. So the research at this point does not say do it with 70% or 50% all the time and nothing else is right. But at this point, the research points, when it comes to range of motion, to the fact that different ranges might be okay, but we'll have to learn more in the future, of course.
I think this also makes a lot of sense. I mean, I think for me, it goes to a lot of the cues that I use are, it doesn't need to be painful. Like 50% is pretty tolerable. I mean, for me, it's like looking for a tender spot, but not a painful spot. And keep in mind, like she said, this is looking at range of motion as the outcome. If you're working with pain, probably the last thing I want to do is induce a high level of pain in the tissues. So, that's a more complicated story, but we're looking at range of motion and we're looking at these mechanical changes in the tissues potentially as being a big part of it. I think what we're looking at here is it doesn't matter. You're always going to have some of those people in class too, who really like to go to town and get in there. And, they have that no pain, no gain mentality. And I think this research just speaks to the fact that, they're still getting something out of it. Maybe as they start to learn to embrace some of the other uses other than range of motion of MFR, which we know there are many, maybe they'll find a place to use different levels of intensity. And this study, again, isn't speaking to that. Again, it's only speaking to range of motion, but it's not a no pain, no gain. Even in range of motion, it's not a no pain, no gain scenario, that we can do it with just a minimal discomfort here. Again, looking for areas that are tender, working around areas that are really painful, and get it really the same amount of effect on range of motion. I think that's really cool. And again, it's just one study, but interesting.
Exactly. And as you're mentioning, working with pain and looking at potential mechanisms of myofascial release, and there's also still a lot to learn, but we do know by now that the nervous system obviously is a big part of that. And we also know that some of the receptors that are registering sense of pain, and then also as a consequence have an influence on your pain sensitivity, they also live in your very superficial tissue layers. So they also live in your skin and in the superficial fascial layers. So if you want to target those in order to kind of speak to the nervous system mechanisms behind the pain sensitization or sensitivity, it might be enough to work those superficial layers. And for those, you won't need that super intense, deep kind of rolling, but more superficial work and a lighter work will also be enough to target those. And I personally, and that's just my opinion, it's not the research, but I'm very, very pleased and happy that over the last couple of years, it's not only no pain, no gain anymore, but people are happy or willing to use softer tools and working in a lighter way, and do understand a lot that light kind of work has huge effects on the nervous system and all the benefits that come with that.
And I think, wasn't there some research recently about the innervation of these tissues actually being the greatest in the more superficial layers, like the skin and the subcutaneous tissues, so the superficial fascia right beneath it. And it actually, I think, goes down kind of progressively as far as innervation goes as we go deeper and deeper in the tissues.
Yeah, there's a really nice one by Katharina Fede and Carla Stecko we've talked about on here, and we can relink to them in the show notes because in this context, that's really interesting as well. So if you want to dive deeper into that, I can put that into the show notes again.
We might have mentioned it on the episode. Well, which
Fascia as a sensory organ, I think.
Thank you. I was like, what was that title?
I think it was probably that one.
It's fun when they all kind of link together too, because there's so much crossover and yet so much specificity in each one topic. So I love that. Again, the range of motion, maybe we want a little bit more intensity there, anywhere from 50 to 90%. But when we look at pain, even just that very light rolling can be very helpful. And I think, we need more research in all of these things, but I think when we're working with pain, one of the big things to look at is not inducing those nociceptive pathways. So trying to find areas that you can work into that aren't painful nearby, that maybe are, a little bit tender, but a tolerable kind of sensation that we can use to downregulate the nervous system and relax into. What I often use, the language I often use is find an area you can, in quotes, work with, meaning that it is somewhat tender, but you are able to relax into it, which is possible in most parts of the body. I will say there are a few areas that are challenging to do that with, especially like IT band and quads. At least maybe that's a personal thing. But I feel like those are harder to work into. So I usually do those a little quicker, which is nice because like we said, you can see range of motion effects even just after 45 seconds. So this is great. The intensity, again, I think still more to learn on all these things, but that gives a little bit of a kind of peek into it. And then there's also different tools we can use. So
there is, but before we jump into them, I just would like to share one more visual that I like to share in my classes, and that tends to work really well. So if you explain to people chili, like a chili in their chili, so pepper in their chili, in their Asian dish or in their food, if there's a little bit of that spice in the food, it's really tasty and you can really enjoy it, and gives more depth to the dish and to your palate. But if it's overwhelming, you won't taste anything but the chili or the pepper. So too spicy is just not working out when it comes to your food. And I feel food anecdotes or food visuals tend to work well, and that one too. So it's people are nodding all the time when I say this, so it seems to work. And I just wanted to share that as an image to work with, maybe.
That's such a good one. I'm going to have to use that. Thank you. All right. So let's talk about tools. I mean, one of the things I love about this is you can like grab a tennis ball and use it. And it doesn't have to be fancy. I mean, for a long time, and I still do this if I'm teaching a workshop or a conference or something, I'll just bring a bag of old tennis balls from a local tennis center, which is really great at first. However, I think if you're someone who starts to use these practices more often, getting some tools that are, I think the biggest obstacle with tennis balls is they tend to sometimes, depending on where you are, maybe slide out from underneath you. So having a little stickier surface is really nice. However, there's a lot of different things and it can be interesting to look at. There's some research on different types of tools. So what do we have for the types of tools?
Yeah, I think the types of tools, as we start to discuss them, that kind of ties into the intensity. So obviously, if you have tried a couple out, some are a bit more dense, meaning a bit more hard, and they tend to feel, the practice with them tends to feel more intense. And then we have softer tools that have a little lower density, so to say. And there are two studies that I would like to point out. One of them is from 2019, and they use different tools in the suboccipital area, so right under your occiput in the back of the head. And they wanted to release discomfort and muscle tension in that area. So that was the goal. And they did find, not very surprisingly, I might add, that the softer tools, the softer balls, worked a lot better. And the authors ascribe that to the fact that with the softer balls, you might just get deeper because maybe the harder tools are too spicy and the tissue firms up against them. So that makes sense to me. If you want to reach deeper areas or deep layers, that the softer tools might work better. That's the one thing. And then there is one other study from 2020, and they looked at different types of foam rollers, again, of different densities. So one was a medium density and one was a very hard density, meaning one was really hard and the other was a little bit softer. And they provided similar outcomes when it came to range of motion. So this study again looked at range of motion, and we really have to look at the context of these studies. This one again, looking at increase of flexibility. They didn't find a huge difference between the medium and the hard tool. So generally, to sum that up, the softer tools might get a little deeper because the tissues can relax a little bit more into that. And then when we look at the harder tools, maybe not a huge difference there.
Yeah. And again, I think it kind of comes back to like, at the beginning, use whatever you have available. What I love is that it doesn't have to be an expensive or difficult practice, but like whatever you have available. And maybe, sometimes you get creative if you're traveling or something too. But as you start to get more familiar with this work, that especially, I mean, that suboccipital region in Chinese medicine, there's an acupuncture point there that's used a lot for tension and stress. So it totally makes sense to me that you, especially in that suboccipital region, would want to be able to relax to have not only the local, but maybe also system-wide effects from that acupressure point. And again, this is just in one spot. So, we're assuming that also applies to other areas. However, you're still going to get some of those effects on range of motion, regardless of the density. So again, use what you've got. Once you get familiar with the practice, I think you'll find that some softer versions, which it's actually really hard to find soft foam rollers, like actually soft. Like I've bought a bunch of them over the years, and you might buy some that are soft and you get them and you're like, this feels just like an ordinary foam roller. So it can be hard to find, which is why I paired up with rad rollers to make our ball, which is the recovery ball, which is a lot softer, larger. And with myofascial balls, if you don't have money to spend, I think the set's $25. So it's not really expensive, but you could also take socks and tie them around your myofascial ball. So like tennis balls are usually fairly softish, not as soft as the ones that the rad ones that I was talking about, but you could put a layer or 2 or 3. I'll use this with patients who are more sensitive, so that they can just have a homemade version as well. Of course, it's a little trickier. You can't like roll around on them as easily, but it makes for something that you can use. And I always like to try and find accessible options at home for like, I use a very gentle version of MFR with some of my fibromyalgia patients. And sometimes what I'll do is just tie a sock in a knot and use that, no ball. So it's really soft, or a couple of socks, right? So depending on how big you want to make it, it's not as symmetrical. It can be a little awkward sometimes, but it's so soft, it doesn't really matter, but it just gives a little stimulus there, which can sometimes work depending on where we're working there.
Yeah.
Or other options are like over a foam roller, you can put some layers of your blanket, your yoga blanket, or a block. I love to do armpit work on the block. You can put a few layers of a blanket, 1 or 2 or 4, whatever you need, so that you can decide and make it accessible, and find a softness that works for you that you can relax into.
Yeah, I was just saying, I like that comment of yours really, really a lot, making it accessible for people at home. And also, if you're excited about this work and want to bring it into the studio, but the studio you're teaching at doesn't have all that equipment, one set of balls, you can buy that for yourself. But then if you have a big class and you would get or have to get equipment for all of them, it's sometimes a bigger challenge. And getting creative with blocks, for instance, as you're saying, or some stuff also works really well on a rolled up mat. So if you roll the mat up a bit more tightly, or sometimes even just a blanket, depending on who you work with, getting creative there to start with, and then see how you can incorporate that into the practice. Also, if you travel around and teach in different studios, you never really know what they have maybe, and traveling around with that huge sack of tennis balls or myofascial release balls might also not be an option. So getting creative, I think, is always great. And I also love blocks or rolled up mats, as I said. So yeah, it works with many, many things. And yeah, just try it out and get creative with it.
Yes. Yes. All right, we got a couple other surfaces that, again, we're just going to brush over these because they do require you to buy some fancier equipment. But I think it's interesting just to look at because there are some different products that offer like a grid or some vibration that are interesting. So take us there.
Yeah, and it's actually something that I get asked quite often. So it's not available in every studio, but it's interesting nonetheless. So you may know these rollers, foam rollers that have a grid pattern on them, maybe even different levels of surfaces. So some parts of it are a bit lower and some parts of it are a bit higher. And initially I was a bit skeptical about them and I didn't really see the value in that. But the studies, or a couple of studies, find that the grid pattern or those layered patterns, they actually show increased results on range of motion and pain sensitivity. So if you're looking to increase range of motion and to reduce your pain sensitivity, these tools had an even bigger effect. I can only speculate, but I think it might have to do something with those patterns on top, grid on top. There's a bit more of that shearing that we sometimes try to induce, so that would make sense to me. And also maybe that the sensory input to the different receptors that we've talked about on here already or before in other episodes, that might be a bit more interesting for the receptors through a grid pattern like that. That kind of makes sense to me. But initially, years before, I thought, what's the worth? But apparently there is one, potentially to that shearing motion and the input to the sensory system.
I think again, we're seeing, we can get great effects without having that. So if you've just got certain tools to work with, use those. But if you've been doing it a while and you want to experiment, or you're a high level athlete and every tiny little bit of range of motion matters to you, if you work with professional athletes and every little bit matters, experiment. Maybe that the grid, I've heard people talk about the grid as being more like a hand because it's not just like this flat, sterile surface, but it's actually kind of multidimensional, as if more like, someone actually working on you, maybe. I don't know. But, if you're looking for every little tiny increase you can get, it might be worth exploring. And I have a grid one, I do like them. I think I've always liked it better for some reason. The flat ones do kind of feel just flat and sterile to me. I don't know how to describe it any better, but there's something about the texture that I just like better. So yeah, those are easy to find.
More interesting. Yeah. And I mean, now it's kind of on vogue to have rollers that have a vibration effect with them. For some rollers, you can even buy like an add-in thingy that you add to the roller, and then it gives that vibration off of it with different frequencies. And there is now more and more studies coming out on this. So I just checked the other day, in the last 2 years, there's really been a number of studies on foam rolling with vibrational tools. And again, we can see that the effects on range of motion and pain sensitivity are increasing a bit with that vibration. So you get a little bit of extra with that vibration. Potentially, I would also say, again, via nervous system mechanisms. That's what I would assume. One really recent study also from last year by Annika Griefan and colleagues here from Germany, they found that the shear strain mobility in the thoracolumbar fascia increased. So basically, that's that slide and glide between the different soft tissue layers in your low back. So that seemed to increase with the vibration tools as well. But as you just mentioned, I think it's an extra you can play with if you need the latest little extra, but you can potentially achieve those results and have very positive effects on range of motion, on pain, and also on shear mobility with other tools as well.
And I love this. Let's just give a little background too. If you're familiar with foam rollers, I mean, I think most foam rollers you'd buy now are in like the $30 to $40 range. You could probably get some for even 20 maybe, and some more expensive for maybe a little bit more. But I think a lot of the vibrating foam rollers, just to give you some context, are probably more about like $100. So we are
or
talking,
even more.
or
Yeah.
more. Yes.
Yeah.
But we're talking about a pretty steep difference. And I do agree. I do think there is a difference with the vibration, and the reason, I guess the scenarios I like to use the vibrating foam rollers, the thing I love about them is that you don't need as much instruction, because usually, at least the way I have my patients use them, you're not really rolling on it so much as just positioning your body weight, whatever part of your body you want to focus on top of that. You could do some rolling as well, but with the vibration, you really don't need it. And so there's a lot less of me having to like teach them exactly how to position themselves and get there. But really what you're trying to do is just place the area that you want to work on top of the foam roller. That could be really almost any body part, and just stay and find a position you can relax in so that you can be there for 90 seconds or who knows. I don't know that we know a specific duration of the vibration, because maybe it goes a little quicker. But there is some increased effects. I would say there's definitely some of that relaxation that I feel, but for patients who I feel like they really need more of that down regulation, I do prefer like the balls, usually, where they can like relax and stay with it and go a little slower. They tend to have a little bit more of a calming effect. But some people respond really well to the vibration, kind of like the same people who, might do a really vigorous practice and then are like in this deep shavasana, kind of like that contrast, right? Of like really shake things up. And again, there's more to learn on how does the vibration influence those. It's going to be influencing different receptors, right? With the vibration versus that slow shearing effect. So it might change how we affect the nervous system, but we still are getting some changes in range of motion, some increased changes in range of motion, as well as pain sensitivity too. So we're seeing all those great outcomes. If you want to experiment and invest in an expensive tool, it's definitely a hard one, because you can't really, it's a tough one to teach with unless you're doing one-on-ones. And even then you'd have to bring your foam roller and leave it with them. They need to invest in it. So I just find this a really challenging tool to actually use with patients or students, but a great one to use on your own, and a great one for students who maybe have the means to buy it, but don't have the time to figure out how to use it. Like the balls might be like the students you work with who don't have the means to buy the fancy equipment, but are patient enough to figure out how to use the balls, the tennis balls that they can steal from their dog. Right. So there's different applications. Again, really interesting. We've got increased outcomes somewhat if you need that. But we have a barrier to use, of course, which is just the expense. So yeah.
Yeah, and when we talk about the vibration tools as well, note that the research is really growing at this point, but a lot of the things are not 100% clear yet. For instance, if those recipes that we mentioned, the recommendations for duration, for instance, if they also hold true for those tools. I recently found a study that looked at the different frequencies of those tools. So apparently you can set some of them to a lower frequency or a higher frequency. And studies are trying to find out if there are recommendations for that one. So there's a lot happening, and many, many studies coming out as of now. So we should probably repeat this conversation in a year or two, because there's probably a lot more information on that in a couple months.
Awesome. I feel like my intuition on that one is that it's probably a little quicker. It feels like I can hop on there and maybe time goes faster. I don't know. I've never timed it, but the difference between 60 seconds and 90 or 120 seconds is hard to guess sometimes. All right, let's head into now talking about some of the combinations and applications. One of the things I like to use a lot is some movement to actually induce more of this shearing or movement between the layers. So think of the foam roller or the myofascial ball pinning down that superficial layer, the superficial fascia, which is attached to the skin. pinning that down. And then as I move my limb, as I bend my knee, if I'm working on the front of the thigh, now I'm moving that deep layer that is, wrapped around the muscles there, now creating some movement between them so you can get this kind of shearing, which is really important for these fascial layers. So let's talk about what the differences are with adding some movement, some joint movement with this foam rolling practice.
Yeah. So another study from 2018 seemed to be a fruitful year for the myofascial release research landscape, showed that the effects on range of motion and also on pain sensitivity were even increased when adding those active joint movements, potentially due to agonistic muscle activity, potentially also due to that shearing motion, I would say, like you described it. So that increased the effects that we could see there.
Awesome. What about when we're using it with things like stretching? What do we see with that?
Yeah. So there's also some research out there. I would like to point to one systematic review by Conrad and colleagues from last year, so rather recent, and again summing up various pieces of research. And they looked at whether you wanted to increase range of motion, or B, you wanted to increase performance. And they found when you did look for an increase in range of motion, it didn't really matter so much whether you added any stretching to the foam rolling or myofascial release practice. So if you want to use foam rolling or myofascial release as a standalone, that's apparently, according to their review, good enough for range of motion increases. A little bit of a different story if you wanted to increase your athletic performance again. So that's like strength or speed. There they found that you could do myofascial release followed by stretching. So there it made a difference if you did only stretch or only foam roll. So foam rolling followed by stretching had the biggest influence or the biggest results.
Interesting.
There.
And I think we've talked about this on a previous episode, but I think a lot of what the research suggests too is that if you're stretching less than 60 seconds in a muscle group, you don't get the performance deficits pre-sport. So I'm assuming the static stretching that they were doing was less than 60 seconds as well. I don't know.
Yeah, the thing is, it's a systematic review, so they compare different studies, and that's typically one of the limitations of those reviews. They're trying to compare studies that are not exactly the same. So you really, if you're totally interested in that, you really have to look at the specifics of different studies and then potentially pick out the one that is most similar to your needs or your setup, because different studies will use different parameters as we've lined out during our conversation today. So that's where it gets a bit more tricky. So if you're working with an athlete and it's about those little nuances that you want to look at, you should probably look at the specifics of and the context there.
Yeah, I'm sorry, I forgot that was a systematic review. But I think it's an interesting one. The first part, especially, that we don't necessarily need to do the stretching. And I think a lot of the stretching and sports medicine research is also, at least what I like to do, I prefer to do the MFR pre-sport and do the stretching post-sport. So you don't have to worry too much about those specifics. Like, there was a lot of new information around this idea of you can actually do stretching pre-sport, but it really needs to stay to less than 60 seconds per muscle group. And, so counting that means if you do 30 seconds in Paschimottanasana and 30 seconds in Janu Shirshasana, still working that back line, that, I'm getting close to that 60-second parameter, or 45 in each would be over. So it gets a little too fine-tuned for me. And I know we're not really talking about that specifically in this episode. We're talking about MFR. So I don't want to go too far down that rabbit hole. But, the MFR on its own is enough. It's all you really need if you're looking for range of motion changes, especially, or stiffness changes, which, brings up a really interesting topic, which is really a controversial and still unknown area of research, is this idea of, the MFR is decreasing the tissue stiffness, but it's increasing performance. Whereas a lot of times, if you've done the athletes training or the fascial trainings with me, we know that you actually want that stiffness in sports. That stiffness is part of, making that efficient force transmission system. However, to each person will be different, because if we're looking at an athlete who has really extremely stiff tissues, there's a point where that can be too much. It's the Goldilocks scenario, right? We want a certain amount of stiffness, but we can always overdo something. And we can also have a scenario where the tissues also become also resistant to range of motion, so that mobility can also be an impediment to performance and strength as well, the functional capacity of the tissues. So I know we were having this discussion offline a moment ago, and it's a very, still a kind of a not completely understood awareness of stiffness of tissues in sports. And maybe you can do it more justice there if you want to add anything.
Yeah, so I don't want to really add into the specifics of tissue stiffness per se, but I think it's a very important point to note here. We're talking specific recipes, very, very specific durations for things in a field that is still largely growing. And I think that's half of the charm, because we are in the midst of a very dynamic field, and I personally love that, and I find that fascinating to see the evolution of that. But if you listen to this a year from now, probably a lot of the things that we're saying is not the whole truth anymore. And just keep that in mind, that the context is important and what we're saying has a solid foundation, but things are still in flux. And I think in one of the first episodes in here, we mentioned that. We talked about research in general in one of the first episodes. And that's the nature of research. And sometimes we have to hold space for that flux and have to kind of live with that sometimes things are or seem to be contradictory, sometimes even just because the definitions for things are not clear. For instance, stiffness, there's various types of stiffness, and sometimes different research pieces don't refer to the exact same thing. So that's where it gets tricky. And I think for us as practitioners, as yoga teachers, it's important to get the overall context and the major ideas, and that's what we're trying to convey here. But sometimes it is about the specifics, and we're trying to filter that for you guys as much as possible. And also, we are moving with that flux too. So some of the things are, maybe sometimes even actually contradicting, because we are finding out about them as we speak in this moment, in this point of time. So bear with us if sometimes things have multiple aspects to them and the picture is not 100% clear yet.
Well, and I think with research, that's always the case, because no two studies completely overlap. You obviously, to have strong research, you need to be able to replicate it. But even in these reviews, there's certain criteria that need to overlap, but they're not identical studies and they're not identical people. And when we talk about athletes, even more so, we're trying to train to our highest potential. And there's so many differences between different bodies, between different bone structures, different collagen structure tendencies, collagen metabolism tendencies toward or away from scar tissue or range of motion or strength. There's so much in our genetics and our training, and gosh, there's a million things, and even our mindset that are influencing it. And so all of that's important. So there's no specific recipe for athletes. I just think it's important to kind of to make a side note of. And I love how optimistic you were that a year from now it would all change. I was going to say like 10 years from now.
That's too much. 10 years, definitely too much. I think in this field, in 2 or 3 years, a lot is changing. And you will see in the show notes that most of the studies that we're referencing are a max of maybe like 3-4 years old. So there's really a lot of things happening. Yeah. I'm optimistic about the dynamic here, definitely. And I just to close that off, maybe one more study, also a very recent one. I would like to mention, we talked about how to combine different movements like stretching or also warm up with MFR, specific again, potentially mostly for athletes. And there was one other study also by Conrad and colleagues from this year, 2022, and they looked at range of motion increases, and they wanted to find out what happens if we do a warm up with concentric movements in that muscle area before, or if we do a warm up after foam rolling, or if we do no warm up at all. And again, the changes in range of motion were similar in all groups. So really, if you are an athlete and you want to increase range of motion and you want to work on that specifically before your sport, that again points to the fact that MFR has a really big potential for that. And even if we don't want to look at all the specifics of the studies and all the teeny tiny nuggets and protocols in there, that for me is a really huge takeaway from today's episode, that foam rolling or myofascial release alone has so much potential, particularly when it comes to range of motion, but also for other aspects. And then also with many of the things that we talked today, be it tools or be it the speed of the rolling, there is a wide range of things that we can try and then can be put into the practitioner's or teacher's hand to play with. And to me, that's a very positive thing and a very affirming thing for practitioners and teachers alike.
I love that. I think this is interesting too, because, we're using foam rolling, and what she's talking about here specifically is for range of motion. Keep that in mind. So what we're looking at here with this study in 2022 is that they didn't necessarily need the dynamic warm up along with the MFR. That doesn't mean you don't still need a dynamic warm up for other reasons potentially, but as far as the range of motion goes, it didn't increase the range of motion outcome by including the dynamic warm up before or after the foam rolling. And so, keep in mind, again, there's more to this picture. There might be I think there's other reasons why you might want to do a dynamic warm up and transition into your sport. But as far as it relates to range of motion, it's not necessarily needed. And, I think all those things are great to note, because all of us are on a time budget, whether you're a full-time professional athlete or you're a full-time corporate desk sitter and a weekend warrior, or whatever the scenario might be for you. We all want to have that time efficiency. So just a quick recap. We talked about the duration and the frequency, and we saw that 90 seconds was a good approximation, give or take. It doesn't need to be exact, whether you're looking for recovery or pain outcomes, whether you're looking for athletic performance beforehand to increase, whether you're looking for increases of range of motion. That's the approximate amount that we're looking for, and that this cumulative effect suggests that we have at least 3 times a week. And then we also talked about the outcomes on tissue stiffness and circulation as well. And, having a minute or two, a couple of minutes, I think they were using 1 minute twice. So again, not too far away from that 90 seconds for increases in decreases in tissue stiffness and increases in circulation there to be significant. We talked about the speed, and we said that there wasn't really a big difference between the fast and the slow rolling for range of motion specifically. But when we looked at trigger points or for stiffness, specifically, but the use with myofascial trigger points was better with static compression. We talked about the intensity we found, and correct me if I'm remembering wrong, Katja, on the recap. We talked about the intensity not really mattering much, doesn't really matter too much with range of motion. We could do 50%, 70%, 90%. For range of motion, it's not as important, but when we're looking at pain, we can get good effects even with very light rolling, and probably definitely want to stay away from that 70 or even definitely 90% realm, that more, that higher intensity realm. We also looked at the tools, and there was that research suggesting that softer tools might be better, especially specifically in that suboccipital realm. Also suggesting that the grid on the tools might be more helpful, specifically for range of motion and pain. We talked about vibration also being a great rule, a great tool to add in for range of motion and pain. We also looked at moving a joint while rolling, also increasing that range of motion and also helping with pain as well. And then we talked about the combination with stretching too, and maybe not necessarily needing the both, but using potentially just the MFR pre-sport, pre-training, and not necessarily even needing a dynamic warm-up then. So we're talking about the MFR for range of motion changes specifically, and stretching not necessarily adding to that. What else? Anything else you wanted to add to that recap? I think I covered it pretty well. Did I miss anything or?
No, I think you covered it very nicely. I want to repeat something that you said in the introduction, which is that even though we have this evidence base and we have these evidence-based recommendations that are supposedly helpful, and I believe they are, there is still the individuality to it. And I think that's something that we should maybe end with, that you are very much allowed to play and to let that be a realm of self-exploration still. So work it out yourself also, as this field is so dynamic and as we don't know all of the things yet. So if something else is making sense to you, keep listening. So that nervous system aspect that we have mentioned numerous times today, and that explorative aspect of it, that really, to me, is a very important one when we look at the mechanisms of myofascial release, or that gets clearer in the research by day, basically, that the nervous system aspect of it is really, really important. And that's also reflected in some of these recipes or recommendations that seem to have some leeway or some range for exploration. So that's me basically just encouraging you to make use of that range within those aspects that we talked about today, and let that be a self-exploratory practice still, and not going by the cookbook only.
Yes. Well said. And I think a great reminder, if you're a yoga medicine teacher, it kind of goes with all of the techniques that we talk about in our trainings that we have for many years, even though a lot of these studies are pretty new, which is nice that the new stuff is actually supporting what we intuitively sense in our own practice and experience. I love it when they line up, because I think it means we have even stronger evidence potentially as well. So, find an area you can work with, one that's maybe not painful, but is a little bit tender. Have a meaningful conversation with it, which is probably like 1 to 2 minutes-ish, maybe a little bit longer sometimes. Use it maybe before your sport or training for performance and range of motion, or circulation and stiffness changes. Maybe use it after your training or yoga, or end of your day potentially for recovery, or for pain anytime. Find a tool that you like. Maybe that's a softer one. Maybe that's just a tennis ball. Find something accessible, but know that, again, that frequency, that repetition is also important. So at least a few times a week, especially if you're working with an area. Sometimes we're just working with transient aches and pains and things, and so you can use it as needed. But if you're working on something specifically that we've mentioned, that frequency, that repetition is important. And then, if it feels good, maybe moving a limb or combining it with a dynamic warm up as well. A lot of it is intuitive, but experiment. Remember that your own experience is the most important, as we've mentioned a few times. And I hope you have fun putting this information to work, to good use. And let us know if you're on the YouTube channel. You can let us know in the comments how you liked it, what you found, what your experience is. If you want more information, we have short trainings and long trainings. We have our full length MFR training, which goes over all of this and 100 times more. We've got over 100 protocols for every part of the body. We talk about the science behind the fascia and the structure of the fascia and the newest research and what it suggests, as we've talked a little bit on today, as that application to working with clients, whether you're a healthcare professional or an athlete or a yoga teacher or a student. We've got lots of tools in there and lots to work with. And we're actually starting up in-person trainings again too. So you could check that out as well. Anyways, lots to choose from. If you're a student, we've got shorter courses, or you can just check out Yoga Medicine online for plenty. I think we have hundreds now of MFR practices on there that you can choose from, depending on whether you want pre-sport or post-sport or range of motion or a specific area of the body or whatnot. Lots of options. Plenty of tools for you to use to support you. And I hope that it's helpful. We will see you again next time. Thank you for joining us. Thanks for listening to Yoga Medicine. If you like the show, please be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com, or check us out on social media as Yoga Medicine. You can also email us at info@yogamedicine.com. Thank you for being a part of our Yoga Medicine community. We look forward to seeing you again. The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.